I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist, and I'm here in a real-life operating room to talk about that medication that wipes your memories. It's called midazolam. Why do we give it? Why are we wiping your memories, and is there something that's being hidden from you when you're under anesthesia having surgery? I know there's many things that you all ask me on social media, my patients ask me before surgery, and this is your chance to ask me live, and I'm happy to try to not hold back, and I'll tell you why we give this medication. Sometimes there are legitimate reasons for wanting to purposely cause amnesia. Sometimes there are unintentional things that happen. So as I see people coming in, Soccer Queen, I Am Devil Woman, Steph, Prospective, Danielle, good to see everyone on here. First things, what is this orange labeled medication? It's called midazolam. The brand name is Versed, and it is a sedative. It's very powerful at calming anxiety. It acts on the GABA receptor in the brain. That's the same receptor that alcohol acts on. Kind of similar to the receptor that propofol acts on. Very different than opioids, ketamine, but some of the anesthesia gases that come out of the ventilator behind me also act on that receptor, so it's a powerful receptor all over your body. It also, however, this is a very potent benzodiazepine. It's in the same class of medication as Ativan. You can actually hear you can hear the similarity in the name. Lorazepam versus midazolam versus alprazolam. Those are all the generic names for Xanax, Ativan. Valium is similar to those. This one's called Versed. This is the most potent. It's so potent that it actually wipes your memories in addition to sedating you and calming you. And hey, Chris, good to see you, Michelle, Hannah, and Kate, and Azan, I'll get to your questions in a moment. So the first thing is, what happens when you're on this table for anesthesia? Because many of you all ask me, is anesthesia just wiping my memories while I'm being operated on so I don't remember the pain? No, that is not what anesthesia is. To be very, very clear, you have to understand this first. Anesthesia is a combination of 4 different things. And we use different medications from the gases, different medications in our anesthesia cart to achieve those 4 things. That is amnesia, wiping your memories, hypnosis, rendering you unconscious, analgesia, which is reducing pain stimulation to your spinal cord and brain, and paralysis. The paralysis is the scariest sounding, but the easiest one to understand. We literally give medications like this one, which is a synthetic paralytic called succinylcholine. And then we also give medications from curare, which is from the poison arrow dart. Literally, this is from that plant in South America. This one's called rocuronium. You can actually hear the name curare in rocuronium. It's one of the many plant-based medications that we use in the operating room. Now, amnesia is a really important part of that, though, because we can't always give you all the medications in here if your body can't tolerate them. And that's when we may need to rely on the amnesia of medications like midazolam that are profound in causing sedation, but not as profound in turning off the nerves that operate your heart, your spinal cord, etc., your blood vessels. Those medications might not be tolerated in patients that are having emergency surgery, who have weak hearts, that are having an emergency obstetric surgery, like an emergency C-section, a lot of blood loss, postpartum hemorrhage. In those cases, we rely heavily on medications like the one I showed you earlier, that powerful benzodiazepine called midazolam, because we can wipe your memories at the expense of your body experiencing some of that pain. Now, your body isn't truly experiencing the pain because you need to have a functioning brain to experience pain. And the medications that you're also getting, like the white stuff, like the gas from the ventilator, like medications like this one, etomidate. These are all working together. Oh, by the way, maybe ketamine. I don't have ketamine here right now, but these all scramble your consciousness. They cause the hypnosis part of those 4 qualities of a complete balanced anesthetic. And your brain isn't necessarily receiving pain signals, so you're not feeling pain. To be very clear, I don't want people to think that they're going to be in pain during surgery. The exceptions do come in when I'm talking about times when patients can't tolerate a full load of anesthesia. Like I said, you're bleeding out, you're on the verge of not making it at all, maybe an open heart surgery, a weak heart, you've bled out a whole blood volume because of postpartum hemorrhage, etc. These are times when that medication, midazolam, can help you go under the anesthesia and not remember, or at least not remember as much of it. So that's one of the intentional times we use Versed. But there's unintentional things that happen that make this very useful. And the biggest secret of all, I'll tell you in just a moment, but I have to answer a bunch of questions that came in here. And then I'll talk about the biggest secret that doctors kind of hide, and that's why we give this medication. Asin says, I possibly remember the pain I go through while I'm in surgery. Oh, I hope we answered your question now. Kate is having a badly set Colles fracture, the wrist. The pain has been awful. Well, I'm wishing you the best for your surgery to correct that fracture there. I hope everyone here sends you positive vibes as well. Chrissy, Sheila, Hannah, and Robin, good to see you. Alex, I'm so happy that you made it as well, or Alexis, sorry. Chris says, Doc, are there any credible studies showing multiple doses of anesthesia will affect memory long term? It is an unknown. We really don't know. It depends on many other factors, in particular what the surgery is. Maybe what type of the anesthesia is being used. We don't know the answer, but out of abundance of caution, it would be reasonable to minimize repeated exposures to anesthesia, especially if there is a pre-existing history of cognitive impairment, memory problems, etc. Very good question, Chris. Miko says, last time I was put under general anesthesia, I hit the nurse waking up. How can I affect my behavior so it won't happen again? It was really embarrassing when I realized what I was doing. Yes, Miko, this is very common, unfortunately. When you're on this table here, you're still unconscious, but you're cussing, kicking, screaming, and there is no solution except that we can try to give medications, often like midazolam, to help with what's called emergence delirium. It may also be a factor, might be affected by untreated pain, might be from pre-surgical anxiety, pre-surgical emotions that aren't processed, depression, etc. We don't really know. If we knew, we would be able to solve this problem. But that's why I always encourage optimizing mindset before surgery to minimize reactions like that. But now let's get to what I originally wanted to talk about, and what is the big secret that we're covering up when we give medications that wipe your memories. Now, many patients, they jump right away to these horrible stories of people that have been violated, touched inappropriately, etc. These are horrible, horrible things, and they've happened. Realistically, they are quite rare. I have personally never seen a case of this. Remember, there's many people in the operating room, and if one person is really a bad actor doing this, there's many people that would be witnesses, and I can't say, obviously, it's never happened. It has happened. There are documented reports of it, and they're horrible and egregious, and we are not justifying them at all. That being said, on the list of things that are likely to happen, it's probably incredibly rare for this to happen. And you should always discuss your concerns with your doctors before, because it's a very, very reasonable and important concern to share with somebody. You don't want to fall asleep in this operating room with that concern in the front of your mind, because that might lead to postoperative concerns and complications, postoperative depression, chronic pain from the acute pain from surgery. Your mindset is very powerful. And you don't want to fall asleep being afraid of being violated under anesthesia. You can and should speak up and advocate for yourself. It is incredibly important for you to be comfortable with who's in the room with you, and to feel empowered to speak up if you don't feel comfortable with someone in this room. Seriously, no one else can do that for you. You need to be an advocate for yourself. But there's other things, and the real thing here that we're going to talk about, that the real secret that we're covering up when we give this medication, we call it an insurance policy. Now, I want to know what you guys think that means. Maybe you already know why we call it an insurance policy, and what vulnerability that shows in doctors and in our medical practice. Why do we call this the insurance policy? And I'll give you a shout out. Alexis says, the anesthesiologist in Brazil who put something in a patient's mouth. Well, that's horrible, Alexis. That's absolutely terrible. Prospective asks, is everyone confused when they wake up, or are they instantly with it? They're often a little bit groggy. Mono live full. Last time I was under anesthesia, I woke up hungry. Is this a side effect? Well, it's often encouraged for you to feel hungry because the hungrier you are, likely the less nauseous you are. Chelsea is having a hysterectomy, and you should tell your anesthesiologist if you're a redhead. It always helps. I don't know of a chronic pain ketamine clinic near Missouri, Sonic Heroes. I'm in the San Francisco Bay Area. But I want to know why do we call this the insurance policy here? Who's going to get the shout out? The insurance policy. Yes, Chris, it is very dose sensitive, you're right. Butterfly is the closest. All right, Butterfly, I'll give you the shout out. If something goes wrong, you're right, we give Versed as an insurance policy because if you're in the operating room here, you're on the bed, what if you remember something? What if you're underdosed the anesthesia? Because the truth is that we don't understand how the mind works. We don't understand consciousness. Your doctors don't really know how anesthesia gases, propofol. We don't know how these medications work because we don't understand the mind that they're rendering unconscious. We also, by the way, we don't understand the mind because we don't understand mental health very well. Why are we in the middle of this mental health epidemic all over the world, but especially in the United States? Mental health matters so much. And it's partly relevant to the fact that we don't understand how the brain works and how certain past events can lead to debilitating mental and physical health conditions that pop up when you're in the operating room. In a room like this, having surgery, when you're unconscious, your mental health conditions can be revealed in some ways based on how your body and mind and brain and heart and other organs interact with anesthesia. It's quite fascinating and it shows how little we know. And because there is so little that we truly know, we give that insurance policy of Versed, the orange one that I'm holding, so that if we underdose, because like I said, we don't really understand consciousness, at least you have some amnesia on board to minimize the risk of you remembering, because intraoperative awareness is very real, can lead to PTSD, an acute stress disorder first, but the PTSD potentially after, and that can be debilitating for the rest of your life. It's horrible. Imagine feeling something that's happening to your body. Imagine hearing things, maybe seeing things if your eyes aren't taped shut. This can be very traumatic, and we give Versed often to help minimize the risk of a little bit of awareness in case we underdose the propofol or the gas or another anesthetic agent because we don't know how much to give. We have some rough estimates based on your weight. Maybe if you have red hair, if you use weed, opioids, other substances, if you have depression, if you're treated with SSRIs or treated with MAO inhibitors or treated with TCAs, based on a couple of things we have estimates, but we don't really understand consciousness. We don't know. That's what we're covering up. That's the biggest secret, and that's why we have a mental health crisis. Why we are so ineffective at truly addressing the root causes of depression in so many of our patients. Why my patients come in here and are suffering in ways that we can't help them. I wish we could. Why we're so afraid of psychedelics. And they certainly have harms, but we don't understand consciousness and how mushrooms and how other substances affect our consciousness in ways to potentially heal us. Obviously, we hope they don't hurt us. They can, right? But this is what we're covering up by the insurance policy of Versed. It's what we don't know. And I'll be honest with you, I want you to know why we're giving these medications, because I don't want patients to think that we're trying to cover up a scam or cover up something that's gone wrong. I mean, sure, things can go wrong in any surgery, anything in medicine, that's always a risk. But it's more that we're covering up what we don't know in medicine. By the way, if you appreciate me coming in here after a long day in the operating room, I'd really appreciate you to hit the like button, share what you've learned with others, and we're going to answer your questions now. So I really appreciate all your support, and Butterfly was the one that kind of got it right. Props to you. Michaela says, what do they do for awake brain surgery? A few nights later, I woke up crying. I'm sorry, Michaela, that you had that. We usually use Versed because we need you to be awake enough to communicate, but we don't want you to remember. It's actually another use of Versed. We're not covering up things. We just want you to not We want to minimize the risk of PTSD. Chris, yes, very dose dependent, the effects of Versed. You're right. Why are children prone to hysteria? Karen, we don't know, but children are certainly at a very high risk of emergence delirium, probably from their stage of development and their maturity. Prince, what is the recovery time after surgery? Prince is getting 2 ovarian cysts removed. Well, I wish you the best of luck for your surgery. The recovery time, you kind of wake up anywhere from usually 30 to 60 minutes after surgery. Everyone's a little bit different. Depends on your anesthesia and your surgery. Prospection, thank you for the kind comments. Elysia, is it rare to be awake and feel pain? It is very rare, especially for routine elective surgeries. And Chelsea, I'm very happy that you are feeling empowered to advocate for yourself next Wednesday. Chris is asking to avoid PTSD. Yes, that is one of the purposes. Now, the body still keeps score. This is not the end-all be-all to PTSD. We'll have to talk about it in a different video, because there's things called central sensitization, wind-up phenomena. The body still keeps score even if you just cause the amnesia, because the body still is keeping score. But there's a lot more to it, and we'll talk about that later on. Soccer Queen says, will you tell us when you wake up if something went wrong? I did that earlier today. Yes, I do that if it's something within my field of the anesthesia. If it's a surgeon, they should disclose that, yeah. Especially if it will affect you in the future. I recently had a case where somebody's body was responding to anesthesia completely haywire, and I suspected it was from the high dose of marijuana that they were using on a regular basis. And I told them after that, hey, on those monitors there, your body was doing all sorts of unusual things, and I'm very concerned for the amount of marijuana your brain is seeing on a daily basis. And I strongly suggest that you find alternatives. They were using it for a particular reason that there are many alternatives for. Once again, I'm not anti-marijuana per se, but there's many unknowns, especially at high THC concentrations that are sold here in the Bay Area. Kentucky says it helps you forget. You're right. Plants and funny hats. Versed erases more than 5 or 10 minutes of preceding Versed does not do retrograde amnesia. It's anterograde, meaning future events. It doesn't necessarily wipe out past events because patients remember me injecting it in them. So therefore, they remember everything right up until that point. Caleb is a paramedic. It's awesome to see. Thank you for your service. How do I attempt to calm patients in emergency situations? In the ambulance, all those people know is the worst moment of their life is occurring. Caleb asks such a powerful question, and there's a couple of things that you can do in emergency situations. Often the midazolam does have a role, and the next best thing is breathing techniques. And it only takes maybe 6 to 10 breaths to begin to get some parasympathetic tone going. Now, of course, if somebody is bleeding out and they're in your ambulance, well, that might not be the time and place to start doing 4-7-8 breathing or 5 in 5 out. You got to be context appropriate, of course. That being said, for minor emergencies, it's something I find very powerful, and especially for routine elective procedures. There are many other things that I do for the more routine case. I have lots of videos on those. Some of it involves aromatherapy, which can often be safe before surgery. Some of it involves mantras. Rituals are very powerful, but in the emergency setting, in an ambulance, usually the Valsalva maneuvers and related breathing techniques are the fastest, certainly not the only. Chelsea, thank you for your support on TikTok and YouTube. Robin, Versed does have paradoxical reactions like you've experienced, and if you already have PTSD, you still could give midazolam to somebody, but it's not going to help erase the past trauma experience. Michelle, the secret was that we don't understand consciousness and we try to cover it up with midazolam. That's the secret. We don't understand how the mind and body are connected. We don't understand mental health, but we try to cover it up with midazolam because if you don't remember, or if we underdose your anesthesia, at least we hope that you don't remember. That's what the purpose of this is. In many, not all cases. And I think it's quite profound and humbling how little we know about the brain, even though we manipulate it all the time with drugs and medicine. Marita says, once in the middle of elbow surgery, you woke up and an endoscopy. Well, Marita, That's what we try to prevent with midazolam. Nathan, can I touch on anesthesia and AFib? Yes, anesthesia tends to reduce the risk of AFib because it quiets the nerves literally in the circuits of the heart that might be responsible for AFib. However, surgical stimulation and anxiety and pain can also trigger AFib, so it's a balance, and that's why we have, by the way, so many beta blockers. We have esmolol here, we have labetalol, and we even have metoprolol in here, and metoprolol. So we have many different beta blockers, should that happen. We also have adenosine as well, if there is something emergent as well. So we have many medications to help minimize the risks of AFib from happening. Very good question. Very, very good question. Alexis has no memory of IVF egg retrieval, but waking up the next morning remembered some events. Luckily, nothing negative. And that's because none of these medications are 100% accurate, right? You can give more and more and more Versed. And usually for the average patient in the bell curve, there'll be a sufficient dose. But like Chris said, these are dose-dependent effects. Cultured Redneck Garage. Do pre-surgery white coat hypertension symptoms tend to relax when under anesthesia? Yes, they do. Very good question. I am Devil Woman says, waking up in the middle of carpal tunnel surgery, feeling surgeon scraping the wrist bones. I screamed. I'm so sorry that you had that experience. I hope that you discuss that with your surgeon after and your anesthesiologist to learn how you can minimize that risk from happening, that risk in the future. Gosh, I'm sorry that you had that. Prince Jean Tom, going under surgery tomorrow, freaking out about being under anesthesia. What is recovering time? Well, Prince, first off, thank you for your vulnerability and sharing that. And I'm wishing you the best for your surgery. And I hope everyone here is also sending you positive vibes. Surgery recovery time, we'll start with the anesthesia. Usually it's 30 to 60 minutes for short surgeries. It might be hours for longer surgeries. Brain surgery, cardiac surgery might be even longer. Now the surgical recovery time can be much longer. Depends on the type of surgery you're having. I can't give you a specific answer without knowing more. When Kentucky had their wisdom teeth removed, they had endoscopy, gave them something right before that knocked you out. Well, now you know what that medication was. Hey, Mrs. Eyes, thank you so much for the kind comments, and I really appreciate your support, and I'll say it again one more time. If you are appreciating me coming in here after the end of a long day in surgery, that like button and following and sharing with others really does support me to do this for you. I don't like to do ad placement or product placement because I don't think that most of those products are actually healthy or good for you, and I'd rather advocate for your inner healing potential, and knowledge is powerful to help you advocate for yourself. Even in scary places like surgery, even when you feel like you have no hope, you have incredible power over your body and mind. And that's what I want to help you grow. I don't want to be out here promoting supplements or natural things that might sound good but don't always work and might actually disempower you based on many factors that we've talked about before, placebo and nocebo effects. So thank you so much for the kind comments. And to everyone who is on here supporting. Much, much, much appreciated. Hey, Alex, thank you for the super thanks there. I really, that's very kind of you. Michael, I am wishing you the best for your CRNA career, and I appreciate your kind comments. Thank you for that super chat again, Alexis. Skater Surfer says, newish viewer, awesome, great to see you, Skater. And Katie, hey, back to you. Karen says that she woke up from a hysterectomy crying. Well, this is really interesting because giving a medication like a little bit of low-dose propofol or Versed to calm you before surgery is a Band-Aid. You might still wake up emotional, crying like you said, Karen, or angry. This doesn't necessarily address deeper or subconscious, I should say, subconscious feelings. Now, we don't have a lot of evidence. This is going into the realms of consciousness that we don't understand, but there's certainly plenty of preliminary evidence that suggests that the greater our mental health before surgery, maybe helped with a little Band-Aid of midazolam, but not using this as the sole source of calmness, can help our post-operative outcomes. And yes, Michelle, all of this definitely beats giving somebody a bite on and a shot of whiskey before going under surgery. Can I show the operating room, Chelsea? I can, and I already have, and happy to show more. Skater is having surgery in a few months, excited but anxious. I'm more worked up to deal with a few weeks of recovery. Well, I'm wishing you the best, Skater, for your surgery, and I hope everyone here is sending you those positive vibes as well. Is there a risk of overdosing, Versed? Yes. What are the risks of Versed? We'll have to do a whole video on that. But just like every other medication in here, just like the anesthesia gases, there is of course a risk of overdose. For Versed, we always are concerned about possible delirium afterwards, ICU delirium, maybe cognitive impairments in elderly or at-risk patients. We don't always know, which is why I like to not use midazolam unless there's a legitimate reason for it. And there are many alternatives to midazolam, right? Why should we use the one that has risks when there are many other medications, some of which you see here, that can accomplish similar things? Great question, great question. We'll do 3 more questions and then we'll come on again later this week. Critter says, I had carpal tunnel done using the white stuff, no confusion, and as I was going to sleep, I was a little scared, so they sang Sleepy Kitty to me. That meant the world. And it was over fast. Well, that is so powerful. Thank you for sharing that story about how positive affirmations are just speaking to patients when they're here. This is the pillow, by the way, that they put their head on. We think it's all about medications and ventilators, and that's a hugely important part about this, no question. But just that human touch, like what we're doing now, I can look you in the virtual eye of the camera here and tell you about, I'm human just like you, and there's so much that we can gain by just having that level of compassion and trust with those around us. And if it's singing that Sleepy Kitty song, that is so much safer than giving you more midazolam or more propofol, isn't it? That's really beautiful. Thank you for sharing that. Okay, 2 more questions. Cannabis and long-term OxyContin, caused me problems. Nell, I'm really sorry to hear about that. If you're comfortable sharing, I'm sure others would learn a lot from your experience, but only if you're comfortable sharing. Eric says, how safe is general anesthesia? Eric, for elective routine surgeries and patients who are healthy, it can be incredibly safe. Michelle says, what I missed is what classifies as emergence delirium. Well, we'll end with your question, Michelle. I know there's more questions we couldn't get to, but I'll be back on live again soon, I promise. Emergence delirium is a state of waking up from general anesthesia, typically, where you are inconsolable, you are not responding to verbal command, and at risk of hurting yourself without typically much memory of what happens. Some patients can piece together some memories of it, but it is explicitly an unconsolable state that often presents a risk of self-harm or harm to others. Smacking yourself, pulling out your breathing tube, etc., etc. Not to mention the psychological risks of potentially PTSD if bits and pieces are remembered. Great question. Can I do your intubation, Judy Roberts? I wish I could. I'm not in Australia, but I'm wishing you the best for your surgery. And gosh, so many great questions. I wish everyone the best for being on here. Hey, Butterfly, thank you for the kind comments. Remember that I'll end with responding to Prince's comment. Prince says, freaking out some. What do I do to relax anxious feelings? Prince, I have 2 videos that went out in the last couple of weeks about how to calm your nerves and be at peace before surgery. You can check those out. I have a couple of very, very specific tips. But I'm wishing you the best for your surgery. And like I say, Susan, I'll answer your question too. Propofol burns, probably from the emulsion that it's in. It's a combination of soybean oil and some other things. But I always like to use it in conjunction with lidocaine, or put it in an IV in the antecubital where it doesn't burn as much. So there's many ways to help minimize that burn. Until next time, you all have more power over your health than you've ever been told, especially here in scary places like the operating room. I'll ask one more time, shameless plug, if you do appreciate me coming on here, I appreciate your support if you subscribe and share what you've learned with others. Until next time.